Hello, everyone, and welcome to episode 318 of the Juicebox Podcast. Today's show is sponsored by Omnipod, Dexcom, the Contour Next One blood glucose meter, and Touched by Type 1.
I'm Sarah. I'm a 37-year-old nurse practitioner who works in New York, which is now kind of the epicenter of coronavirus. I have two little kids, a 5-year-old and a 7.5-year-old boy, and I'm married, and my husband's a teacher.
Sarah reached out to me just the other day, wanting to share her experience as a healthcare worker in New York City who's recently been diagnosed with COVID-19. Please remember that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any decisions about the coronavirus, becoming bold with insulin, or just about anything else. This is just a podcast. Talk to a doctor. You can get an absolutely free, no-obligation demo of the Omnipod tubeless insulin pump by going to myomnipod.com/juicebox. Find out today about the Dexcom G6 continuous glucose monitor at dexcom.com/juicebox. And to see if you're eligible for an absolutely free Contour Next One blood glucose meter, go to contournext1.com. To check out the world's most delightful type 1 diabetes organization in the whole of the world, at least as far as I've seen, touchedbytype1.org. How old were you when you were diagnosed with type 1?
17.
So you've been doing this for a while.
Yeah, I've been around the block a few times. 20 years. Actually, it just was my diaversary this week, actually.
Oh, well, congratulations.
Yeah.
Big week for you, huh?
Yeah, I guess.
How long have you been listening to the podcast?
Not that long, maybe 4 months-ish, but I like what I tend to do with a lot of podcasts is I kind of bolus a lot of shows. I'm like, oh, wow, this is really great. He's got a lot of great ideas, and I like the way he thinks about things. And, I really like some of your guests and stuff. So I listened to a bunch like for a few weeks straight. So I don't know I would say I've probably listened to about maybe 100 of your podcasts.
Oh, thank you.
Just a small number.
Keep going. I'll tell you the interesting thing that you're seeing around coronavirus is that people aren't commuting as much. And when they don't commute, they don't listen to their podcasts as much. So I need this coronavirus thing to be over just like everybody else. But not as much as you need it to be over. So I got a note from you the other day, and you said, hey, I have type 1 diabetes and I have the coronavirus. And I was like, you're getting right on the podcast.
Well, I was thinking about saying something to you about it. And then I listened to your one that you talked to Jenny, and you were joking with her like, hey, can you just get coronavirus so we can talk about it on the podcast? And I was like, oh my God, I have to message you.
Could you believe she wasn't willing? Honestly. I mean, what kind of a person wouldn't just, risk their own death so I can get a couple extra downloads on one episode of a podcast? No, I just really, listen, I mean, I really was hoping to get some insight. So let's do this first. So you work in a hospital, right? Are you in a, like,
yes.
Can you tell me what department you work in? Is that okay?
Yeah, I guess transplant.
Okay. So that seems like a place where you wouldn't want anybody to be sick.
Yeah. Yeah, no. Our patients are immunosuppressed, so they're actually more at risk of getting the virus than even I am. So, obviously if you're type 1, you're immunocompromised, but we give these patients medications that suppress their immune system.
Right. So I guess the question is, do you have a feeling for the epidemiology of like how you, like, do you know how you got sick, or is it just, were you just waiting to get sick?
Yes. It was either a coworker or a patient.
One of your direct patients?
Yes.
Yeah.
So I was, it was right before everything got really crazy with everyone being isolated and stuff.
Yeah.
And we were kind of doing business as normal-ish. And then my coworker left work early, had a fever. And then I was going to go on vacation. My husband was going to leave the country. He was going to chaperone a trip, but then that got canceled because of coronavirus.
Yeah.
And then, so I was home and he was home. So I wasn't even scheduled to go back to work. And then I started feeling a little funny, a little sick, like I had congestion. But then he was complaining that he felt like he had the flu. Now, I've never had any flu to my knowledge. I could have had it and just not had it, known that I had it, but I've never had like aches. I probably haven't had a fever since the 90s. Like that's just, I don't get a lot of colds.
I haven't thrown up in 3 decades. So at some point you're just like, hey, this doesn't happen to me anymore.
Yeah, I do throw up a lot.
Okay.
Not a lot, but when I was pregnant, it was like, I was like 30 something weeks pregnant. If I didn't have food in my stomach, I would throw up. So I do tend to vomit, but like no, fever is never anything I have had.
In fairness, Sarah, I've never been pregnant, so I can't apples to apples this with you. But so you start not feeling well. Like so today's March 28th. How long ago was that, do you think?
I can give you the dates because I actually had to replicate the dates for a public health nurse called me the day after I was diagnosed.
Right.
So this was, I started feeling unwell March 15th, but I thought maybe I had a cold. The last thing on in my brain was coronavirus because I wasn't really suspicious when the coworker left work. It just didn't really like, oh no, he's probably just has some flu or something because it wasn't a big thing. And we weren't allowed, I think it wasn't a big thing because nobody was allowed to test anyone. I mean, Trump I think at that point had just come out and said, oh, anyone could get tested, but no one could get tested.
Right.
We couldn't test anyone. It was, so I didn't really think people really had it. I mean, I thought it was coming, but I didn't think that it was like pervasive. So I would say Sunday night, I felt sick. Monday morning, I was like, wow, I have a horrible headache. Feels like I'm getting a sinus infection. I've had a couple of those, like over a decade ago. Mm-hmm. They required an antibiotic. So my husband goes to the pharmacy. He picks up an antibiotic. I have it at home. And I just feel like a little tired. I felt I had the headache. And then I felt like I couldn't really smell, like my sinuses were blocked up, hence why I thought I was getting a sinus infection. And then the next day, my husband's like, oh, I feel worse. And he calls to try to get tested for coronavirus because he's like, I feel like I have the flu, but we all in my house all get the flu shot because I'm type 1, I'm a healthcare provider. Yeah. We have little kids. We all get the flu shot like immediately when it's offered. We're very vigilant. About it. So I honestly, not that you can't get the flu once you have the flu shot, but it's much less likely. Mm-hmm. So, so Tim was like, I think I might have it. I'm like, I don't know, like maybe, but that seems kind of far fetched, but it's all over the news. So like, yeah, that's what,
Everyone
a lot of people jump to, but I'm like, I don't think so. So he calls and they're like, no way, because you're too healthy to get tested. He's not short of breath. He just has, he had like a subjective fever, which kind of means he had chills and felt like he was, having trouble regulating his temperature, and just fatigue, like, low energy. Yeah. They wouldn't test him. And then that night after he had called, somebody texted me from work that a patient tested positive.
And then all of a sudden it feels very real. And this is,
so then I'm like, maybe.
Is it. Well, this is all really, it's so funny how quickly things have moved. So you're describing basically 13-ish days ago, and it really is the night and day difference between what we are thinking of now and what we were thinking of back then. Back then, it was just sort of like, hey, it's overseas. It'll probably get here. We're not sure what's going to happen yet. And it just really ramped up so incredibly fast. And I guess you really, at one point when we look back and and pay attention, I'm assuming it would have been here and just not as prevalent weeks and weeks before we really were thinking about it.
Oh, yeah, it definitely was. I mean, based on like where our numbers are now, it was definitely circulating. Yeah. And I'm sure people had it and just never knew that they did.
Right. Oh, 100%. Yeah. Do you think you had that thing where you can't smell? Would you lose your sense of smell or taste?
Oh, yeah, I have that. And I still have that symptom.
Oh, that's with you
I'm
still.
pretty much over the other stuff, but I still have that. And that's actually kind of how much when I cemented that I diagnosed myself as having it was so like the day after Tim couldn't get tested. Then the next day I was like, can you call them back? Tell them that your wife was exposed. And they still would not test him. And then later on, I call my supervisor and she's like, you can do a telehealth visit.
Okay.
So, and that's a big thing now in order to screen people for being tested, but also to see other doctors because we're not sending anybody to see doctors because that's like a big risk. So I saw a doctor online and I kind of exaggerated my symptoms a little bit because I was like, based on what I have, I don't think she's going to test me. But at that point, I also thought maybe my coworker had it.
Yeah.
Maybe because they left with a high fever. But then I also was like, I had a patient who I admitted to the hospital who tested positive.
Let me jump in. Tell me your thoughts about wanting to get tested at that point. I mean, you figure you've got it, right? You've been in contact with people who had it. Did you just want to know? Like, what changes knowing to not knowing?
Part of me wants just like the public health data.
Yeah. Like
capturing a positive, but being more careful about quarantine. Because at that point, I've gone to the store a few times. Like I've done stuff.
Sure.
Being more careful. And also like not wanting to expose patients because eventually I was going to have to go back to work.
Right. So just having that answer maybe gets you, well, I mean, it should definitely get you out of work. Is that right?
Well, we'll get to that.
Well, okay. Things a little so upside down. It doesn't matter if you've got corona as long as you know how to be a nurse.
Not quite.
Not yet.
So they still wouldn't test him. Right. They said if they knew I was positive, they would test him. I talked to the doctor and I kind of told her I had a cough, which wasn't a straight out lie. I'd probably coughed a few times, but I didn't have a persistent cough at all.
Okay.
Nothing like they're talking about. I never had a fever. They still wouldn't test him, but they put in an order for me. But then I had to set an appointment. They're not accepting walk-ins to get tested at my job. So I had to wait for 5 more days from when she put in the order to even get tested.
Oh, wow.
Yeah.
Well, there weren't tests at that point, right? Like I think
they weren't prevalent.
There's a rapid test, I think, that's just becoming available today. Is that right? Did you hear about that?
Yes, I heard that there is a rapid. I was actually more interested in the. I saw there was I don't know when the blood test is coming out, but that one is going to be able to. Yeah. I think that's going to be really, really useful both for people that are taking care of the patients and for the patients themselves.
Right.
If that's if that becomes like widely available.
Oh, I think my wife keeps talking about that. She's like, one day I want to find out if I've had it or not. Because she's like, I swear I had it like a while ago and before anybody was talking about it. And I am looking at an article right now. U.S. approves Abbott Labs 5-minute rapid coronavirus test. That was 6 hours ago. This story went up. So,
oh, wow.
Yeah. So this just happened.
When I did finally get tested, it was a quick turnaround. It resulted like 6 hours later.
Okay.
Which was nice.
So I guess we have to talk about it. Is that image online true? Because it looks like there's a swab on the end of a long wooden stick that goes in through your nose and heads back towards the center of your brain.
Oh yeah, it's extremely uncomfortable, and they really have to turn it around, and that's where some people are falsely getting negatives too, and that's another reason that it's good to have a blood test
because the swab is not being done right.
Because exactly. Right, okay. Like you really have to like turn it around in there. and it's very uncomfortable. So if the nurse has been properly trained and that's all they're doing all day long, they're probably doing it right. But we have like any and every nurse in the hospital doing it. So they're not necessarily getting good samples all the time. And I'm not blaming them. They have a million other things to do. Like if a nurse is just doing that all day long, she's getting good at it. And she's like dealing with the patient's discomfort. Because like my eyes were watering. It was very uncomfortable.
Yeah. The picture online and there's a description that says it goes back to being parallel with your ear or something like that. And I'm like, wait, what?
Oh yeah.
You're like, oh, I don't want that. Please no. But I do like the idea of knowing. True. I mean, obviously the way the numbers get skewed constantly because everybody hasn't been tested. And I mean, do you think that from what you're seeing, is the rate of death going to continue to drop as we find more people have had it? And
like I'm sure the mortality rate would be less if you could actually capture like more accurate numbers.
Yeah. Well, okay, so are you still doing transplants at this point, or has that stuff been? I guess that's not elective. That needs to be done when it needs to be done, right?
I think I'm going to talk about it more generally and not about my program specifically.
Right.
But I think everyone else is being much more careful about who they do it to, because you're massively immunosuppressing people.
And then bringing them to the dirtiest place.
I think most programs are way like doing a lot less, only if it's really urgent.
So your husband has it, you have it. How do you stay away from your kids? Like, what do you do in that situation?
I'm pretty sure they have it too, honestly, because then, another clue, germane to what we're talking about, is my insulin requirements went up too.
Okay. So that
was another reason I thought that I had it. Not usually when I get colds, it doesn't go up.
Yeah. Arden's doesn't. Arden's usually goes down a little when she gets sick. But just something obviously with your body change because you saw your insulin needs change at the same time.
Yeah. Diabetes gives you a window to certain things that the layman doesn't necessarily see.
Get to see. Yeah.
Because you can see different changes.
Yeah.
So my that was another kind of thing that muddied the water. My younger son had been sick for weeks. So I kind of thought maybe we had what he had.
Yeah.
Maybe we just have some kind of a cold and it's affecting us differently. But his was like a runny nose and a cough.
Mm-hmm.
But during this time, his cough was getting worse. So bad and at that point he had been maybe sick for 3 weeks. So I actually had to take him to the pediatrician.
Right.
And at that point I wasn't, tested yet when I took him to the pediatrician. And she basically was like, oh, I could test him for it, but only if you were positive. And I'm like, well, I have an appointment in a few days at my job. Like I can only control what I can control.
Right. But I have it. So
yeah,
I just don't have the test
yet.
Yeah.
Like I've never felt like this before in my life, but
And so having it is like, what is it? Just like every other virus you've ever had, or is it different? How's it been affecting you? Quick hitting ads today. I want to remind you that the links to all of the sponsors are right there in the show notes of your podcast player. You can also find them at juiceboxpodcast.com. And here they are in quick succession. To get an absolutely free, no obligation demo of the Omnipod tubeless insulin pump sent directly to you, go to myomnipod.com/juicebox. Now is no time to let up on your health. To check out the Dexcom G6 continuous glucose monitor, dexcom.com/juicebox. And you're going to need an absolutely rock solid blood glucose meter to go with your gear. And the one you want is the Contour Next One. You know where to get that at, contournext1.com. The Juicebox Podcast is proudly sponsored by all of these wonderful devices and by touchedbytype1.org. Having it is like, what is it? Just like every other virus you've ever had? Or
I would say I had more fatigue.
Mm-hmm.
and I don't usually have a blood sugar bump. And I was definitely a little more insulin resistant, and the not being able to smell it all, even when I felt like my nose, like I was maybe congested for 3 days.
Yeah.
And then the congestion went away, but I still couldn't smell, and I still can't smell now. And that was actually, I have an au pair that lives with me. And actually, when I said that one day, like I was like, if you guys want to get takeout, that's fine. I said at home, even though we were trying to be very careful about it.
Right.
But I was like, I can't smell or taste anything. And he was like, oh my gosh, that's what they're saying is a symptom of coronavirus, is you can't smell or taste. And that was when I was like, oh my God, I have 100% have it.
That's got to be like a bad movie.
I need to get the test.
Right. That's a bad movie, right? Where somebody turns to you slowly and says, on the news, they're saying that that's one of the, and you're like, oh, I have that.
Yeah.
Have you freaked out at all? Or like, so you've been a nurse a really long time, right?
Yeah, I was a nurse for 9 years. I've been an NP for 5 years.
Okay. So you've got a lot of experience in this space. Is this unlike anything you've ever seen before, or what does it kind of match up with from your experience?
From what I'm feeling, or the pandemic?
From the work side, yeah, from what you're seeing at the hospital.
Oh no, this is way different than I've ever experienced. Yeah, this is completely different.
Necessary, in your opinion?
Oh yeah, because of just the amount of people that are affected. Yeah, like they, that's what everyone's talking about, flattening the curve, because there's just not enough. There's not enough ventilators. There's not enough beds in the hospital to take care of all the sick people, because no one has any immunity. Because people have immunity to the flu. There's no immunity to this, and
we're all just getting this new thing for the very first time all together. And
yeah.
It's moving. It's moving more quickly than we see with other viruses, but we're not sure if that's because none of us are immune to it, or if it's because it has an ability to move more quickly, but it doesn't really matter why. It's just, it's spreading so incredibly fast. Yeah. And so when we're all hearing in the media we take in that this is about spreading out people's illness so that hospitals can handle it. That really is the entirety of the goal here, right? Like, it's not, we don't think some of us aren't going to get it. Like, we're all going to get it at some point in the next year or so, I'm imagining. And by all, I mean a lot of people are going to have it to varying degrees. What is the varying degrees? What are you seeing? Like, what would you call your case of it? Like, in the mild, mid, and harsh?
I wouldn't say I'm asymptomatic for sure, but I would say definitely mild to very mild, because I was feeling so low energy, and I like working out. I was, lifting weights and stuff at home. Like, I was doing my normal thing, except I could fall asleep in the afternoon, and I'm not usually, like, I can't usually take naps and stuff. I just would wake up, I would drink coffee, and it was like I didn't have any caffeine. Like, I was very low energy. So my body was definitely fighting something. And the headache. Oh, that was another thing. The headache, I could Tylenol and Advil didn't do anything for the headache.
What did finally? Drinking? No, I'm
no.
Just kidding. No. Were you able to alleviate the headache or no?
Not really.
Yeah. How long did it stay with you, or is it still with you?
I would say I had maybe like a 2 out of 10 headache today, but at the worst, it wasn't like severe because I've had migraines before. Right. This was like maybe a 6, 7, but the fact that like normal pain medicine didn't do anything was pretty obnoxious.
Yeah.
Luckily, I was at home for a long time.
What about at work right now? Are they just using, is it all hands on deck? Like, how is this being staffed and handled?
Well, if you're too sick to work, you're too sick to work.
Sure.
But you're allowed to come in if you have 7 days after your onset of symptoms, which I was out of that window when my vacation was over.
Okay.
And honestly, I didn't know that I had it the first day I came back to work was when my appointment was.
Yeah.
So I walked into work and I'm like, I'm pretty sure I have it, but we have to get, I don't know that I have it.
Right.
and I wasn't, I don't have the fever or the cough. So I wasn't like, having the big name symptoms. So I came back to work. I tested positive and I got the result as I'm walking in my door at night. But I was already out of the window. And the next day we like called everyone to make sure it was okay for me to work, from occupational health to various doctor, infectious disease experts to make sure it was okay. But the policy right now is either 72 hours after your last fever or after 7 days of when your symptoms started, you can go to work. I'm extra careful. Like I really, mask and hand hygiene very, very meticulously. And
Right.
and before this even happened, we were staying out of the rooms much more.
Yeah.
Like we're limiting patient contact. Worried about, getting whatever from them, but actually more worried about us giving them something. Cause I'm sure there's many healthcare workers walking around with it and they just don't have any symptoms, or their symptoms are so mild, they don't know.
Sure. How about you and your husband? Like, this might be unfair. You've got a couple of little kids, so maybe you're not running around like smooching every time you see each other, but are you like air high-fiving, or like what's your level of like intimacy like now that because he's through it too, right?
Yeah. He feels 100%. Wouldn't say I'm 100%. Like he had worse symptoms for a few days, but mine have been milder, but more like prolonged. No, I didn't really, cause I felt like the horse was out of the gate. Like I felt like I had given it to everyone already because we were all at home. I was cooking, like, very cuddly with my kids. Yeah. And I think also because once you're quarantined in your home anyway, I felt like I was more needy with like affection with my family because I'm not seeing other human beings going anywhere, you can't like touch anybody. Yeah. So I felt like I had exposed everyone to it already. I mean, maybe like, I don't think I was sharing as much because we were trying to do more like being a little more careful at home with cleaning, washing things. Like I was having my kids do the chore of like cleaning off the doorknobs with the Clorox wipe every day and the light switches. We were doing more like disinfecting at home, but like honestly, after I figured it out, like I was like, it's already, everybody I'm sure has been exposed. I mean, maybe I'm being a little like blasé about it, but I felt like I've already given it. So I didn't really change much. And it's very hard because my little kids are, they're not, because we've tried to have them have better boundaries, especially the little one before, but he's very bad about it. He'll be very sick, have a cold, and still want to kiss you on the lips and stuff. So I'm not very, very good about it.
It's interesting because your human nature does take over. I mean, I've got 2 children, and when they're sick, you do have that feeling like, oh, I'm going to get sick too. I guess it's okay. Like you don't really stop from doing the things you normally do for them. Like you don't like kick them into a room and like close the door and go, listen, if you're still alive in 5 days, that'll be great. We'll come back and get you. You're in there helping them and, and doing what they do. You have them out and they're sitting on your lap and watching television. And
well, I think also for coronavirus, because I researched it enough to see that it doesn't seem like it's hurting children very much. And my children also, they're very healthy. So I was like, parents overall aren't terribly concerned, I think, about kids in general, but I think I was even like less concerned because I'm like, I'm the most immunocompromised person in my house. Like,
why is no one concerned about me? Maybe I should be worried about me a little bit. Well, it's very interesting. I mean, the whole thing's really interesting because when you hear stuff like, it's a strange way to talk about it when you hear them say, it's mostly people who are older or compromised. And you're like, well, that's not nice to say out loud because, there are people who are older and compromised who are listening to the news also. And so that's not exciting news for them. What you just told them is 100% of you, are having a hard go of this. And so I get what they're doing, trying to keep the masses to be calm. But then you will see like I've seen a little kid have it and be on a ventilator already. And, it's just like, I don't think this must be one of the very first times that as a nation at the same time, we're all conscious of the idea of we don't want to get sick. And if you really look back at how you don't live like that. You live knowing that you're going to get a cold sometimes, or you're going to have a virus, or something's going to happen to you. Like, I don't know that it's a reasonable expectation to live without being sick. I mean, it sounds pretty impossible to me. And so, like, where do you draw the line then? Like, you see some people are, you know, on their boats, or there was just an arrest in New Jersey recently where there was like somebody like threw a house party and charged, I think, admission, like turned it into a business, and they got raided, and the guy who ran the party is being charged. And like, so, you know, don't do that, obviously. But like, where's the line? Like, we got food today, you know, like brought in, and I broke the packaging down, you know, like I was on Breaking Bad, you know what I mean? Like, I took everything out of the bags. The bags went in the trash. Then, you know, someone else brought me plates. You know, I put the food onto the plates. I threw away the packaging from the food and everything, and then wiped everything down afterwards and washed like 1,000 times. And Kelly's looking at me like, "What are you doing, man? Like, just relax." And I'm like, "I don't know." Like I said, you know, we don't know where all these things came from, and I just don't want to be sick. Like, it keeps, for me, coming back to, I don't want to end up in a hospital right now. Is that a smart thing for me to be thinking?
No, for sure. And that's the thing. Even very healthy people are sick on ventilators. So it is reasonable for everyone to be extremely careful, not only to not spread it, but so you don't get sick, because you don't know, even though you have a healthy immune system, some people are just getting horribly sick. Like my coworker that had it was way sicker than me, and I'm the immunocompromised one. Right. So it's you don't know.
Yeah. I think for me personally, in my mind, I'm not wanting to end up under medical care while the hospitals are so taxed. Just because that just seems like, you know what I mean? Like, you know, if there's 10 nurses and 10 doctors and 50 patients, I don't feel like I'm going to be getting like the hands-on care I would be hoping for. Not that people wouldn't be doing their best, but it's stretched thin, you know? And then my next thought is, I don't want to be the person, like, I don't want to live for the rest of my life knowing that, like, my neighbor's grandmother died, you know what I mean? Like, and maybe it was me. Yeah. Like, because I had to what? Have Chinese food? Like, do you know what I mean? Like, I that's the thing. And we've been in this house for like 2 weeks now. And I have to be honest, I'm okay with it. I just really doing my, you know, and I'm lucky enough to be able to obviously do what I do from where I live, but it's not that bad, you know?
Well, I think with the takeout, so for a while I was resisting it, trying to be so good. Well, it was first that I felt like I was sick and like I might have it, but then I also felt like I was scared that all these like local businesses were under such duress that I'm like, maybe we should order a couple times.
Yeah, right. You're also trying to support because you're also looking at your own, well, listen, you're still working, but there are people who aren't working. People are going backwards financially every day. And then local businesses are, and anybody who's ever run a business knows that most of them are barely operating at even. You know, they have to keep moving to work. You know, there are going to be places that don't open back up after something like this.
Oh yeah, for sure.
It's just very, I don't know. It's just, it's different. I've never experienced anything like this.
No, I don't think this has ever been in our lifetime.
Yeah. Now, what we want next, I'm assuming, is we're hoping for inoculations for the future, like sort of similar to the flu vaccine. I don't know, but it's really crazy. So, have you seen anything like if I said to you, and I'm not asking you to, but if I said to you, tell me a really scary story, you have one of something you've seen at work? Or what's your level of, like, what do you see there?
Well, like a specific.
No, I'm just wondering if it's like, is it as bad as we're all imagining?
To me, it's horrific, and I've seen a lot of stuff. I mean, I've seen a lot of awful things. You know, I worked in an ICU. I've seen some terrible things that, like, how can this happen to human beings? You know, people innocently going about their lives. But I think what's most like hardest as like healthcare providers, I think sometimes is seeing, because like it's almost like an expectation to see older people that get really sick with something like this, or people that already have a few other conditions get very sick. I think it's the hardest when you see people like in their 20s and they were completely fine, like walking around, and now they're like in a terrible state. You know, they've got a machine for their lungs. They basically, you know, have machines working for as their heart, like horrible, like they're next to death.
And it feels
that's the most horrific.
Yeah, it is. It's how we all think. I mean, it's, you know, it's funny. It's wrong, but it is how we all think. Like if you see an older person, like, oh, they've lived a pretty decent life. You know, like that's how your brain writes it off.
If somebody's 70 something and passes away, not that it's not sad, but like, oh, they've had a chance to live a life. If someone's in their 20s, you know, they're just starting out.
And so that's what they're talking about is happening too with care, right? Like once we get down to rationing care,
oh yeah,
that's how those decisions then get made, right? Is it by age and health?
Yeah. I actually read it because I had read about that happening in Italy, but a coworker of mine sent an article about a New Jersey hospital.
Yeah.
I forget the name of the hospital, but it was the article was out there, but the doctor was talking about already making the doctors were having to make the decision once the patient goes on the ventilator, like if they don't look like they're gonna, you know, live a while, like if they don't think they're gonna keep going and make it through this, they're just taking them off the ventilator to sterilize it and give to another patient, because it's not fair, you know, because in the ICU we do incredibly extraordinary things every day. We have machines for almost every organ. It requires a lot of money, a lot of personnel, but we can do I've seen many like people that were dead for like weeks come back to life. Yeah. Honestly, but there's not the time and the staff and the, more importantly, the equipment to do that for everybody that you want to give a chance to. So the doctor was talking about, taking, if there's 3 patients that they took the ventilator away from because they didn't think the patient was going to make it in the long run, and they couldn't give them in this situation now, like that's the thought, that you're not going to be able to give these people the chance. So doctors at my job were talking today about that, similar kinds of things, like changing the way we make decisions in healthcare.
So it's really the equivalent of a war movie where you've seen where a medic comes along, looks at somebody and goes, he's not going to make it, we're going to go to the next one. But that person isn't
that's
dead.
A really good synopsis.
Yeah, right. So you just sort of, you start making these decisions, and then then that has to weigh on, you know, that's not a decision you want to make. You want to exhaust efforts, and then if someone passes, they pass, right? But you don't want to bail early.
And that's what we've been trained to do, honestly.
Right. Because what if you're wrong? What if you just look at somebody and go, that one's not going to make it. We'll take the vent, get the vent clean, move it over to this person who we know with the vent's going to do well, and you're wrong about that. And that's
because you could pick the other person, and they might end up passing away in the end.
Yeah, it's just they're decisions that no one should have to make. And am I right to say, in the regular course of medicine, these decisions don't normally have to get made?
Yeah, exactly. Right. They don't. And I actually had been talking about it because I thought about it in the past week that, like, honestly, a lot of us are going to need some mental health like support. Yeah. Because this isn't like a normal, like even the way the units are set up and stuff, like the way, because no visitors are allowed. Mm-hmm. Yeah, like the patients crazy. Are lonely if they're, you know, because not all patients are like out of it on a ventilator. There's a lot of like patients that know what's going on and their family can't see them. Like it's a dystopian, like the hospital is like a dystopian like place, because it doesn't seem like this. It's completely, and there's so few people working. They've minimized all the people working in the hospital. Mm-hmm. Like it's a very weird, lonely place.
Yeah, that fluorescent lighting is a little odder, I would imagine, today than it is normally, right? Yeah. Just sort of feels like the 4th episode of a zombie television show where like everybody's like, it's going to be fine still. We're just working hard and we're going to get past this. Except by the way, we are going to get past this. It is going to like flatten out, and people are still going to have it, but they're going to get to keep their vent, if they need one. It's just this is the time. This is the spiky time right now. And people are, I mean, we're not talking enough about the cases that have, resolved and recovered.
Yeah.
And that's starting to happen. We're starting to see those. I think the last numbers I saw were like over 120,000 cases in the U.S., somewhere over 2,000 deaths, but also somewhere over 3,000 recovered. So, that's hopefully the next bit of news we're going to start getting is, how many of these, I'm excited for the day where it says, we have 150,000 cases and 100,000 of them have, recovered already. And, so it's just I don't know how you're doing it, honestly. Did you say you're in a hotel right now?
Well, they're doing a lot of things. I'm sure they're getting really good rates on hotels because nobody's traveling.
Yeah, right.
But they're also understanding that the commute and everything is much more stressful, more difficult, and honestly, because it's like no one wants to take public transit.
Right.
So the parking lot, because I drove to work this past week, was crazy to get in. And I don't normally drive. I usually take public transit.
Yeah.
But I think they're understanding that, and also then they're also understand that people don't want to expose their family members necessarily. So at least like if you, stay here in between, and then if you want to kind of shower off, or I saw a lot of memes about like nurses being like, I'm just going to, you're going to see me strip down to my underwear before I walk in my house. Just mind your business.
Just out front on the patio.
So if that's the way you feel about it, like it's a safer place. I mean, obviously I don't feel like I need to protect but it's nice having like to not have to
somewhere you can go to do that. Yeah. I've heard stories of doctors sleeping in their cars at hospitals because they don't want to go home. So there's all levels of like, you don't want to, like, if you've got a family at home and they're basically sheltered in place and they're not ill, as a healthcare professional, you coming into the house is probably the worst thing that you could do.
Yeah. To expose everyone.
Right. It really does make you think, doesn't it? Like, what does expose everyone mean? Like, do you know what I mean? Like, you're just, is it touching something? Like, is it as weird as like I touched the desk and a day and a half later my kid touched the desk? And
I think because it's this disease is a lot of like unknowns that everyone's scared about it, because I don't think a lot of it's not that clear, and everyone's policies and procedures keep changing and the recommendations keep changing. So it's a scary disease because we've never dealt with this before.
I'm finding it really fascinating to watch states that are where we were 2 weeks ago and how they're acting like, oh, it's not going to be that big of a deal. And I'm like, is it not? Like, 2 weeks from now, are you going to be like, oh, we should have done something? Like it's just because listen, when this was all happening, I was in Florida with my son and he was playing baseball. He's a college student playing baseball. And we were like, hey, it's springtime. This is great. And then all of a sudden, there's these conversations about, hey, you're going to get sent home from school, or, spring break's going to get extended. And now he's home for the rest of the semester. And my daughter's going to high school in my kitchen. And, like that stuff 2 weeks ago was just things people were talking about. Like, have you heard this might happen? And so I think you're right. There's just not enough. I think there's not enough top-down leadership. Like somebody just needs to say, like, these are the rules. Everybody follow them. It seems to me that if we all just started doing the same thing 2 weeks ago, we'd all be a lot closer to it being over.
We'd be in a much better place. But it didn't come from the top because, I mean, the president had different ideas about it from long ago.
Right. I'm seeing here, there's ER workers are saying that a quote, every man for themselves atmosphere regarding their protective equipment has kind of like crept into New York City. Sort of like you're on your own to protect yourself because we're out of stuff.
Well, yeah, there's there's a limited supply. I mean, my my hospital definitely has a good amount, but because the amount of patients and like we're going to be expected to go so far above like our normal capacity.
Mm-hmm.
I don't know if you saw Governor Cuomo talking about how we have to increase the capacity. So every hospital has to increase the capacity. So even if you were prepared for the amount of people you have, so many people are on isolation. Like it's just like an obscene number. So if you're taking care of the, we call them COVID patients, they have a lot of protective gear. But if you're not,
You're basically in your
you're
shorts.
you're limited. You're limited to what they give us some, but it's kind of, you have to make it last.
So, like, if I'm delivering a baby, do I just pull my T-shirt up over my nose? Is that not quite there yet? But so there's a descending order where the gear's going.
Yeah, for sure. No, they have like a lot for the COVID patients, but for the rest. But at the same time, the problem is sometimes you don't like we've been talking about, you don't always know when people have it or not.
Yeah.
So like you could walk into a room, like I did a few weeks ago, not knowing that the patient had it.
And that's it. And that's why the telemed stuff for other stuff, out in the world, pediatricians visits. My wife isn't feeling well with something that's not this. And she did, she had a phone call with a doctor that ended in a prescription. And, a month ago, you would have been like, really? That's weird. But because that's not really something you ever think of as a doctor, like writing a script from your description over the phone. But I guess it's a better decision than asking her to come somewhere.
Oh, yeah, for sure. Yeah, my endocrinologist who called me because she got routed my COVID result. And she's like, oh, yeah, and we're going to do telemedicine and you'll just upload all your stuff and all that. And I'm like, yeah, okay. I guess it makes sense.
Yeah.
Although for me, it doesn't really matter.
Well, for you personally, it's interesting because, for you personally, it doesn't matter. You've had it already. Yeah. And you can't get it again. We should all get everyone should get a T-shirt who's had it already, right? Like, yo, don't worry about me. I'm good, baby.
Yeah. Well, that was the other reason my husband especially wanted to get tested because he felt like, I want to get tested because I want to know if in like a few weeks I can help people if they need help, like if they need groceries or something, and I don't have to worry about getting the virus.
Mm-hmm. I'll tell you, the one thing that talking to you makes me feel exceptionally good about is that no matter what I do, all these articles, and I've had a doctor on already, Jenny's come on and talked about it, and now having you on who has it, and obviously you're doing fine. Not that everybody's going to have the same experience you're having with it, but it makes me feel better because there's so many of these articles that are popping up about COVID and 19 and diabetes, like what should you do? And after you go through, 2,000 words, there's always an overview at the end. It says, so basically, wash your hands and stay away from sick people. And you're like, oh, clickbait, more clickbait. You know what I mean? Like just what a horrible thing to do. Like drive people in because you've had it now. You have diabetes. You've been a nurse. You're an MP. Like, what should people, in your opinion, with diabetes be doing right now? Anything different than anyone else?
So when it was starting to kind of become real, I guess sort of like the end of February when really we should have started the lockdown, but things were coming down that soon, Italy was saying all kinds of stuff. Now I have pretty well controlled, not Arden well controlled, but my A1C's in the sixes. Yeah. And I was like, I think I'm going to, step it up a little bit, get myself a little tighter and eat healthier, more fruits and vegetables. I'd been kind of doing vegetarian since January, but I was like, less dairy, more fruits and veggies. I was trying because I know I'm immunocompromised and I do work in the medical field to be even more vigilant with being healthy.
Right.
So that was my biggest intervention. It wasn't I didn't buy, to be fair, I'm a mild hoarder at baseline. So in my basement, I already had 1.5 big things of hand sanitizer. I had some wipes. I had enough stuff. But while a lot of people were starting to hoard things, I was trying to like make myself follow a healthier diet,
right,
and pay more attention to my blood sugars. That's what I was trying to do.
So while everyone else was looking for hand sanitizer, you were like, I'm going to have an extra fruit and a sit-up here.
Yeah.
By the way, baseline mild hoarder is a t-shirt, in case you're wondering. I don't have the time or energy to put that into effect, but I feel like that is going to be a big seller in the coming days. It's, I mean, I threw a couple cuts of meat in the freezer, and I'm usually more of a, let's just wait and buy it fresh kind of person. But you just thought, listen, the one thing I did while you were doing a sit-up is I was refilling Arden's prescriptions in February. Like I was paying attention to what was happening overseas, and I looked at all of Arden's scripts, and anything that had a refill available, I sent in. I was just like, okay, I'll take more insulin. I'll take more insulin pumps. I'll take anything that you're willing to give me. I'll take right now.
Well, let's be also, because I'm a mild hoarder, that I have 30 vials of insulin in my refrigerator. I have so much pump sites. I have like 2 insulin pumps. Mm-hmm. I'm wearing a Medtronic sensor, but I have a Dexcom in the basement that I need to switch over to. So I have excessive diabetes supplies. I mean, I think because I've always tried to, get prescribed more, etc., that I've just ended up with more. I don't know. A little bit
extra on every time. I just was like, I don't know. I thought, I don't want to need this. Like, I don't know what's going to happen. Like, I didn't know how society was going to
for sure.
react,
and if you don't have like a ton of stuff, yeah, definitely. Yeah. But because I've just had an excess of stuff for a while now. Yeah. I don't know if it's just because I'm not using as much, and then you keep getting, I've been on an insulin pump for 17 years. So like, I kind of stayed ahead of the curve, and I've had like, you guys talk about sometimes people like, going between insurances, or they just don't have good coverage. But I've always, and that's, I think, part of the reason, honestly, I went into the nursing profession having diabetes, because I always knew that I needed really good employment to buy my supplies and good insurance and stuff.
Oh, so having diabetes made you think, I need a really stable job that comes with health insurance.
Yeah. It honestly, I do think it really affected the ways I was thinking about professions. Yeah,
I can imagine. I mean, I don't pressure Arden about it, but every once in a while I'll be like, hey, you see how we all have stuff for you? See mom's job, the insurance she has, everybody needs a job with insurance. I know you have dreams. They're nice. I don't want you not to, don't forget your dreams, but don't forget you need insulin too. And look at me. There's no way I'm going to stay alive much longer. So I'm doing my best here. But I mean, let's be honest. I'm not going to be 95 while you're 40. So pull it together. Do your best. I think it's I don't think it's unreasonable to consider. You know what I mean? Like, I think it's smart to think about it. But that's what I did. I was just like, all right, let me get these. And don't get me wrong, I wasn't hoarding stuff. I was just like, look, we have prescriptions. They're up to be refilled. I'm going to refill them now, because, it's easy to be like, oh, it's all going to be fine. And it probably is all going to be fine. But I just didn't want to get in the situation where Arden needed something and that company got hit with this virus and got slowed down even, you know what I mean? Like, whatever it was going to be. I just didn't want that to happen.
Actually, there was an article written, because a friend of mine shared it with me. It was a type 1 diabetic who I don't know what their job was. I think it was in business, but they wrote it like an op-ed piece. I don't know if it's the Wall Street Journal or something, but talking about how this might affect their disease because the supply chain might be affected somehow. So it's a big thing to consider for sure.
It probably won't happen, but if it does, it does. And then what are you going to do? Who are you going to call? Like, in a world where we all basically live a life where anything you need, you can have almost instantaneously. Right. Yeah. And so all of a sudden, what does it mean if somebody tells you, hey, we're going to get those to you, but it's going to be a month from now? Here's a bag of needles and a vial of insulin. Like, good luck. So a lot of us, Arden definitely included, she leans heavily on the technology she has. And so she she needs the stuff to make it go. I don't think we couldn't not do it the other way. I'm pretty sure that I think I could reverse engineer my knowledge back to MDI pretty easily, but still it's, no one's looking for that. And I'll tell you what, it would be like getting diagnosed all over again for Arden.
Oh yeah.
Because she doesn't have any recollection of getting shots. So, it would definitely be an all new. And so I just thought, all right, let me be ready. And I did the same, not with food. Like we didn't we only have a basic refrigerator. I don't have I don't have 3 freezers in my basement or something.
Basement,
like
yeah. I have one deep chest freezer in the basement.
See? Well, you are a mild hoarder then. Congratulations. What's in there?
I think I got that when I was breastfeeding my kids.
Oh.
And like my refrigerator, freezer, and my kitchen isn't very big. It can't fit like a very big refrigerator. It's okay size, but like if you're storing up a bunch of breast milk to go back to work, this is probably TMI.
Not at all. Are you kidding me? Wait till you hear next week's episode about sex from the female perspective.
Oh,
this is not going to be too much information. Go ahead.
No, so like in a deep chest freezer, breast milk lasts longer.
Yeah. Oh, okay.
So I think I got that. I think with my first kid, just so I could store more breast milk longer.
Gotcha. Oh, that's a good idea. I mean, now I'm trying to imagine how much breast milk you can pump, but we're getting off topic now because that seems like a massive amount. But that seems like a really important reason to have one because Kelly's like, should we have one of those freezers? And I was like, I heard they use a lot of electricity, and what exactly are we going to put in it 5 seconds after this is over? You know what that made me feel like, and I bet you a lot of people feel this way. When there's like a power outage, ever since we've had a couple of hurricanes.
Oh, yes. Irene killed my basement.
Right.
And I lived through Sandy, too.
So, right.
Which was also a mild emergency, but my house was okay.
But didn't Sandy make you feel like I should have a generator?
Oh, yeah. We got one. I think we got one after Irene, though.
Okay.
Because that hurt my house pretty bad.
And so I had that same feeling. I should have a generator. My wife's like, we need a generator. But I resisted. I was like, we don't need a generator. We don't. We definitely don't. Unless we need one, but I think we're not going to need one. So I was able to resist that idea. But so have you heard, what are people talking about how long is this? Are we at the apex for the New York, New Jersey, area, or is this not it yet?
I don't think it is. Yeah. Honestly, I might be being a pessimist, but I would love to be proven wrong. I feel like it's going to be another month or two because the amount of people that have been diagnosed, I don't know. I can't imagine. And some of these people need to be on ventilators for a very long time.
Right.
I mean, if we get more ventilators, honestly, if we don't get a lot of ventilators,
it's going to go faster, right?
Yeah.
Yeah. Because nobody's going to live
not
through
to be very morbid, but people won't live. But if we get a lot of ventilators, it's going to last a long time because some people, I have a good amount of ICU experience. Mm-hmm. Some people can exist on ventilators for a very long time,
and that could end up being necessary for some of them who are hit harder because while most people are probably going to have your or your husband's experience, the people who have an opposite experience, it's an incredibly severe and dire experience.
And I think it's much harder for people who have a family member that's never been sick a day in their life
to imagine.
I think a lot of people who have chronic diseases or family with chronic diseases, you along the way kind of accept certain things. If you're a realistic person, there's I talk about it with people in a knee-jerk way. I could overdose on insulin someday. I have a more risk of dying than the average person. And I think if you're a wise person and you have family members with diseases, you think, oh, well, maybe they're, they have more of a risk. And I think they are more likely to be okay with the patient, passing away because they've dealt with a disease for a long time. But if you go in there and your husband's 40 years old, never been sick a day in his life, and you're do everything for them.
Right.
There's no reason he should be dying right now.
It's the implications of your life, right? You have type 1, so there's extra variables around your life. So
for sure.
Right. And a 65-year-old, 75-year-old person in a normal everyday setting doesn't have the same implications that they do now that this virus exists. Now their context is different now. It's a very strange thing to hear. I think that's where some of this consternation is coming from, right? Is that we don't really talk about dying like this ever. We don't talk about mortality. We don't talk about, we talk about health like it's fixable. I know for sure my kids think that whatever goes wrong with them, someone will just fix. Like, and most of us feel that way, right? Like what could happen to me until you get one of those things that nobody can fix. And then your understanding of the world changes. And, so we're just hoping that everybody can stay in their understanding where, it all will work out fine. Like most of us get to live like that for a while. The lucky ones, at least.
Yeah.
Yeah. Well, it's really crazy. I really appreciate you doing this. Did we not talk about anything that we should have talked about?
No, I think
we did it.
We covered my disease.
By the way, is it a disease? Sometimes I hear people call it a disease, but it's a virus. A virus or is the COVID? Like, I don't understand. Do you?
Well, I consider it like an infectious disease.
Okay. All right. Because I always wonder, like, sometimes somebody calls it a disease on television and then sometimes they don't. I'm like, well, is everyone right? Or is no one right? So I appreciate you doing this.
Sure.
And good luck with everything. Huge thanks to Sarah for coming on the show as a type 1 who's had the COVID-19 virus. Please remember that Sarah's experience with COVID-19 was her own, and yours very well could be different. But I thought it would be incredibly comforting to hear from someone who had the mild symptoms that you hear about. Maybe not frequently enough on the news. Huge thanks to Omnipod, Dexcom, the Contour Next One blood glucose meter, and of course, Touched by Type 1 for sponsoring the show. And how about a shout out to Sydney for refreshing all of the music that you hear on the Juicebox Podcast. That's right. While the rest of these podcasts are circling the wagons going, I don't know what to do. Nobody's commuting anymore and listening to my podcast. I'll probably just put out some real short episodes, to make it look like I'm putting out a show, but I'm really not. The Juicebox Podcast is coming through with absolutely new music, all new content, up-to-the-date information, and next week, we're going to talk about with type 1 diabetes from an adult female perspective. Please don't let your kids listen to that one. You know what? Since you're here and basically the rest of your day consists of leaning on the kitchen counter wondering what time to go to bed, why don't we listen to all the new music together? Uninterrupted like. Thank you so much, Sydney Muller. Your talents make this show amazingly better. Here's the refreshed theme. Not all podcasts do this, but I put special music over top of the ads so that you always know you're being sold to. You deserve to know that. And Sydney, who by the way is 15 years old, I believe 9 the first time she wrote the music for the show, updated the ad music too. This last track was a surprise. I only asked Sydney to update the music that I had, but she even wrote a third piece that I love so much. I'm going to use it at the end of the show. So you used to hear the theme at the beginning and the theme at the end. Now you're going to hear the theme at the beginning, the ad music at the ads, and this little ditty as the show ends. Okay, everybody, do your best to stay well. I'll talk to you soon. Like I said, there's another episode coming in just a couple of days, an After Dark episode about female sexuality. Dr. Nadelman might be on pretty soon again to update us on the bigger picture around Corona, and there'll be some Ask Scott and Jenny at the end of the week. Thank you so much for listening to the Juicebox Podcast, even during tough times.